How can I compete with that? How can I compete with that? So good morning, everyone. I am definitely competing with that. Welcome to HETT North. You are here this morning because you are interested in workforce. As you all know, we've published the long-term workforce plan, and this morning is about talking about the workforce plan. But how can we talk about it without thinking how technology can support us to deliver effectively the workforce plan? So I am not going to spend too much time here because I'm sure you're dying to hear all about it. What I will say is throughout the day, mics will be going around if you needed to ask any questions. After this, there is a sponsor session, which is a case study. So please stay for that. Enjoy the day. And if you need to ask any further questions after the session, please find any of us around. We will be here, some of us throughout the day, some of us not. So enjoy your day and hope to speak with some of you after. Thank you. So over to you, Phil.
So good morning, everybody. My name's Phil Jennings. I'm the Chief Exec of Health Innovation Northwest Coast. So we're one of the 15 health innovation networks in England. Our job is to accelerate the spread and adoption of innovation across the NHS. Now you might be wondering what innovation has got to do with workforce, but actually through our programs last year, for instance, we released over 350,000 hours of productivity back to frontline care through our workforce initiatives, working with over 40,000 frontline staff. So in fact, innovation and workforce are very, very closely linked. And today we want to talk about the role that digital specifically has to play in workforce. So I'm pleased to say I'm joined by two super experts on the topic who I'll get to introduce themselves. So Catherine, starting with you.
Okay, hello everybody, good morning. Thank you for coming to the first session, appreciated. My name's Catherine Toole. I am the Head of Product at the NHS Digital Academy, and I'm also the Head of User-Centred Design for the Workforce Training and Education Directorate. And prior to coming to the NHS, I built DDAT capability for central government, so lots of parallels to make, I think, today. Henrietta?
Hi everyone, so Henrietta Imbiabankas, I'm Head of Portfolio in the new NHS world, which has blended learning, allied health professions, advancing practice, and pharmacy. So dare I say, holding that temporarily, but who knows. So really pleased to be here.
Excellent. So let's start with a little bit of context setting. So if we think about the NHS workforce plan, Henrietta, if I can come to you first, what does it say, and specifically, what are the main implications from a digital point of view?
Yeah, thanks, Phil. So it does say a lot, as you can imagine. But I think the fundamental point there is we are starting to think about the workforce. Whilst we're looking at more in terms of numbers, we are looking at different as well. Because I think we would all appreciate that the healthcare provision and services has changed, and it will continually evolve. We are seeing, our aging population. We are seeing lots of comorbidity. So there is a really good reason why we need not just more of our professionals, but also different skills and different set of developments to really get them there. Now, apart from being more and different, there are three key priorities in the long-term workforce plan, which is around training. So what do we want to do with training? I think we can all agree that we can't continue training our workforce the way we always have done and expect something differently. So we're looking at training people differently. But also what we know is the fact that there are people who have the right behaviors, values, and attitudes, and potentially, the prerequisite qualifications to join our health workforce, but for whatever reason haven't been able to. So how do we utilize different approaches to attract those people into training? So apprenticeships being one key feature in the long-term workforce plan, making sure that we utilize flexible approaches like blended learning, and so to really attract a diverse group of people. Now, when we talk about retention, so that's the second priority. How do we retain, which I particularly like the word maintain, because if we are maintaining our workforce by providing the right environment for them to work in the right cultures, then we wouldn't need to retain them. So what are the sort of interventions and work that we are doing to really retain our workforce? So looking at the people promise, for example, how, we will value our workforce, because fundamentally our workforce is what supports us to deliver care. And then the final priority is, how do we reform education overall? So again, that's where I think digital comes in. So we cannot reform education without paying attention to the potential that digital has in helping us shape the way that we educate our workforce. We need to think about, do we still need to train people using those traditional methods? The length of training, so all of that needs to be thought through, and the long-term workforce plan is basically set out to do that. Obviously, we cannot deliver that without the complementary DDAT plan, which will be published at some point. But fundamentally, that's looking at developing the digital professionals within the NHS. I mean, let's face it, the NHS only has 50% of clinical workforce. The other 50 is made up of non-clinical workforce, digital workforce, and all of that. So it's really important that we pay attention to those. Now, that will definitely look at three things. How can we support those that we've got, our clinical informaticians and the profession, but also how can we grow the capacity of that workforce? And then finally, how do we enable through training and communities those DDAT workforce that we have within the NHS? So I'll stop there. Thanks, Phil.
Thanks. So looking at that DDAT workforce, so digital data and technology. So Catherine, how do we start in creating a workforce plan there? So what's already in place? What can we scale? How do we make that fit for the future?
Yeah, I mean, that is a big question. I'm just wondering how many DDAT professionals there are in the audience today. Is there anyone here that considers themselves to be a DDAT? Right at the back. Just the one. This is a big problem, isn't it? I'm a DDAT professional. I've been a DDAT professional pretty much all my working life. And the first issue we've got is attracting people into the NHS. I've got a real problem with this, because I actually think that the challenges here, the opportunity to work with big data, the opportunity to work on things that are meaningful, are a huge, huge pull for DDAT professionals that we don't really make the most of. So I think what I'd like to see, and it's definitely in the DDAT workforce plan, is a new way of attracting a more diverse, richer workforce coming in as DDAT professionals and kind of doing their time in the public sector, if not in the NHS. And I think that requires, frankly, some good old-fashioned marketing. It requires those of us that are already in here to go out and sell the benefits instead of constantly talking about the disadvantages. And that, for me, would be the next point, is there's attracting people in, and then there's giving them a good, rich working life when they're here, which is something we all want, right? That can be quite challenging. Often the way that we finance projects, the way the processes that we use, almost squash sometimes innovation. They squash sometimes the pace at which DDAT professionals want to work. And we have to really look at the working environment. If we want people to do more and do differently, then we have to create a working environment which they can do that. So what's very encouraging, I've seen the draft of the DDAT workforce plan, and what's very encouraging in it is there's a lot of focus on community, on scaling, on looking at transferable skills, at bringing more people into elements of the DDAT workforce, looking at what can everybody do that's traditionally been perhaps a DDAT function, being really sensible about the scaling of it. And then I've got another thought that I'll share with you. Why not? Why not? That's what I'm here for. We talk an awful lot, don't we, Henrietta? Henrietta and I like to go 10 rounds over this one. We talk a lot about digital literacy of the entire workforce. So we know this is an issue. Yeah, we know this is an issue. But my personal view is that most people now, an awful lot of society now, have a certain amount of digital literacy in their daily lives. So people who we consider don't have the literacy perhaps to work, perhaps in clinical informatics, they could still use smartphones, right? They buy things on Amazon, they book flights, they are actually interacting in digital and with AI, in fact, almost on a daily basis. And what we need to do is we need to try and make it less frightening. We need to try and make it We need to try and make sure that people are bringing in their lived experience into their work more, and that we're making more parallels. And we need to make sure that we're building and buying systems that are more intuitive to use. I'm ahead of user-centered design, so I would say that. I believe user-centered design is one way out of this. If we design and build systems in a more intuitive, easier way to use, then our digital literacy problem won't disappear. I know it won't disappear, but it will go down. So I think there's lots of things, and by bringing a talented DDAT workforce in and really looking after the ones we've got, building good communities, making sure they've got a strong professional pathway, all of those things, we should together be able to push from both sides, both by transferring the skills and also building better tech.
So after we've invested in training that workforce, if we move on to retaining the staff that we do have, do you have any thoughts on how we can improve that retention, either of you?
Let's head into speak first.
How do we improve retention? I think there's always a sense that the grass is greener somewhere else, and the commercial sector or the private sector is the best place to go to. But I mean, listen, for years I've been saying that people don't realize how fortunate we are in terms of the NHS or the public sector, because and it's only recently that I've actually finally found some evidence to substantiate that statement, in the fact that in a recent survey ThinkTech did, the NHS actually came second to Apple. So that for me is a really good starting point. So I think there is an element of who we are attracting, because nobody comes to work in the NHS for the money, fundamentally. So once people are there, of course, people have to earn to be able to get on with their day. And doing good work means that they're rewarded appropriately. So that's great. But fundamentally, people do it for other reasons, for that value. It's a values-driven reason. But how do we ensure that people enjoy what they do on a day-to-day basis? I mean, we talk about the quadruple aim, and the fourth aim is joy at work. So how do we ensure that the people that are working for us are working in areas that gives them joy? So having that variety, I think we are really fortunate, because with digital, we are getting more roles. So more and more, you are seeing doctors and nurses and allied health professionals who are informaticians, who are developing AI skills, who are entrepreneurs. So the options are opening. I mean, I look at myself and my career, and God, I have done a variety of things which gives me joy at work. So absolutely, for us to be able to retain our staff, we need to make sure we think about their health and well-being and give them meaningful work that gives them that joy.
Yeah. I think that's, can I respond to that? I think that's really well said, Henrietta, and I've definitely had moments of joy, but I've had moments of despair, and they're largely around pace, capacity, and the pressure to deliver on unrealistic timescales with unrealistic budgets and with a lack of capability around you. If you ask DDAT professionals why they leave the public sector generally, it's not unique to the NHS, they will tell you it's when they feel isolated, when they feel frustrated, when they can't get things done. And I think the onus is on, if we believe in digital transformation, if we believe that this is going to rescue us, it's going to be one of the main things of our future, then we all have a role to play in that. And it shouldn't be a kind of them and us thing. It should be that, we all try and amass the digital skills that are required in our role. And for a lot of us, particularly those of us in a leadership role, this is actually about understanding how you get the best work out of digital teams, how they need to be constructed, what the pace they need to work at, the technology the tools that they need to do their jobs, and the air cover actually that they need at the senior level to be able to work at pace and achieve things. And I think the more and from the academy point of view, the more we can put out programs there that bridge that gap of understanding, so that we all understand each other. What are the leadership trying to do? What are the commercial and financial restrictions that are our lived experience, and how do we work together with those? The more we can join up, and the stronger the communities of practice that can express what do we need, what do the DDAT professionals need to thrive, to give that value back into the system, that the better it will go. And I think we're getting there. There's really positive shoots. There's wonderful things like the Topol Fellowships that allow people to have the space and time to develop something innovative and clinical alongside DDAP professionals being mentored. There's really good stuff going on. We just need to scale it and share and work in the open and collaborate, and we will get there.
Brilliant.
Eventually.
So we're almost out of time. There will be an opportunity for questions from the audience. So while you're thinking, briefly, can you mention, you've both talked about training. Does digital lend itself to novel techniques in terms of training for the whole workforce? Just briefly before I go to questions.
That's your bag, isn't it?
Yes,
Go on.
Absolutely. I mean, listen, it's not going to be an option anymore. So there has been a recent review of technology-enabled education, and it's not just for health or social care, it's for the whole higher education sector. And we have definitely seen digital making that difference. So we are socialized into our professions. If you're training with digital, not only are you starting to gain those skills, but your attitude to digital is different as well. And the way you utilize digital to deliver care is different. So we are seeing a real change in higher education provision and the use of digital in education and training. And we do need our clinical educators to support that work as well. I mean, I can see Neil there. Neil is working brilliantly on a virtual hybrid learning faculty to develop that educator skills as well, to support that the use of digital enabled education.
Fabulous. So thank you both. Does anybody have any questions for Henrietta? Yes, at the back there. We've got a roving mic. If you could just tell us who you are and where you're from.
Thank you. Jason Bradley from Countess of Chester Hospital. Lots of thoughts coming out from that, so thank you very much. A couple of quick ones. One around digital literacy, and I love that we need to make it less frightening, but a couple of thoughts. I don't perceive that we really join up professional education and training with the digital agenda. We train people and then dump them into hospitals, in particular with systems or in the community. And also with user-centric design, fantastic. Looking to my left, we buy a lot of systems, we don't design them, and we buy them and they're not intuitive, they're not user-centric.
Yep.
So just a couple of challenges in there.
Yep.
And any thoughts from either of you would be
Do you want to
grateful.
take the first one?
So I'll pick the digital literacy one. Some universities have started some really good work. I think the problem we've got as a system is that the exemplar practices do not stretch far and wide, and it's not adopted consistently. So I'll give you a typical example. Kent Medway Medical School. They've incorporated an assessment, so a pre-assessment before you even start, of your digital literacy level. It's been incorporated through the whole curricula. So as you go through the curricula, not only are you developing your digital literacy skills, but you're also developing your informatics skills, entrepreneurial skills. So there are a lot of digital innovation built right through. I mean, we are in Manchester. Salford University is doing a similar piece of work with, nursing and social work students. So it can be done. There is evidence that it can be done. But until it's done consistently, we will continue to have that gaps across.
Yeah, now your second question is the answer to which will probably get me fired, if that is indeed possible. Yes, we buy, we don't build. We buy a lot and we don't build. And of course, there's an awful lot of pressure on people to buy on price. So 2 things that I would like to see, and this is my personal opinion because I can see my bosses in the audience. So this is my personal opinion, and not the opinions of the Digital Academy. The criteria at which we buy stuff, I think, is changing and should continue to evolve to reflect more the vendor's ability to support the implementation of systems through training. Can I challenge you? I don't think we hold our suppliers to account enough. I was a supplier. And I know all the tricks. And I think our own lack of, potentially, if you don't mind me saying so, and I certainly don't mean you personally, but our own lack of time and potentially in-depth understanding of the technology means we're a sitting duck for any vendor that wants to sell and scarper. So the more we build capability and understanding within the system, the more we can hold our suppliers to account for the things that we ask them to do. There's also The social scoring within the vendor, I think, should be expanded to include things like mentoring and training to build our DDAP profession. If I could have one wish, I would say every single person that earns a penny as a vendor out of the NHS should have an onus to try and help build our capability and mentor us from within. And the more we understand things, the better it will go. And sorry, Phil, I always was going to be a pain in the arse. The final thing I would say, talking to you, the final thing that I would say about it is that user-centered design, I know, it can be applied not just to things that you, as you probably know, not just things that you build, but to things that you have bought, looking at the user interface, trying to understand why people are having problems with the implementation of a system better and what can be done to fix it. And there's some great case studies here actually today of people who've done that successfully. So I don't think UCD is just for when you are building something from scratch, because inevitably we won't be able to always do that.
Brilliant.
Yeah.
Well,
shut up, Catherine.
Look, folks, I knew this would have stimulated a lot of a debate, but regrettably, we are out of time. I'd just like to thank you for attending this first session, and could like to thank both Henrietta and Catherine for their participation today. Have a great day at the rest of HETT North. Thank you.
Thank you.